Hello friends, welcome back to my channel. Today I am going to tell you regarding the OET speaking module, that is a role play, and it is based on the orthopedic ward. From the setting we can get to know that it is a known case or an unknown case. So how we can impress the examiner. So today I will tell you proper perfect demonstration for a role play to achieve a high score. So as based on the setting orthopedic ward, this role play is a known case. So well friends, uh, when we get the role play cue card, we can first get 3 minutes to prepare our role play. So in that time we have to keep three things in our mind. First is the setting, second is the background history, and the third one is the tasks. So see, from setting we get to know that the case is known, and now the background is history is that a patient 37 years old is recovering from a fractured leg sustained in a fall, and you are explaining the care plan and addressing their concerns. So see, here the patient is in at the recovery phase, so that's why patient will be discharged. So as a nurse we have to explain the care plan to the patient as well as the concern which the patient have. Okay, so then next is the first task. So first task is based on confirm. So while the task is on confirm based, so that means we have to confirm the reason for the visit, that is from the patient side as well as from the nurse side. So here in this cue card role play, we have to see that the reason is from the nurse side. So first of all, we have to give our self introduction, like myself Raman Gill, one of the registered nurses working in this orthopedic ward. So friends, always use proper setting, full setting. Speak full setting like this orthopedic ward. Don't say that I am a registered nurse working in this ward. No, we have to speak proper and full sentence. Anything like clinic, hospital ward, or medical clinic, anything, but speak in full sentence. Okay, so see here, the introduction is myself Raman Gill, one of the registered nurses working in this orthopedic ward. So as here the case is known, so we have to speak like this for the verification. Could you please tell me your name and age, please? Okay, so like this we have to ask from the patient. Next is, once the patient said that her name is Susan, so we say as a nurse, all right, Miss Susan, I am here to tell you regarding your pre-discharge discussion. How are you feeling now? Because see, next sentences find out how the patient is feeling. So we can say, how are you feeling, Miss Susan? Okay. So see, next task second is reassure. Reassure means the patient is having some concern. So we have to reassure the patient so that the anxiety of the patient will be reduced. Okay. So well friends, now patient while we are asking from the patient that anything or any problem with the patient, so she replies us that yeah, she is having problem regarding healing process. Then as a nurse we can say, Miss Susan, I totally understand how difficult situation is for you, but try not to worry. I'm here to help you. I assure you that there will be a healing process, like the bone will heal naturally, but it will take some time, and moreover there is a body amazing ability that it will repair itself. Okay, so like this we have to assure the patient. Again, in task they have said find out any concern or question, so we can ask from the patient, Miss Susan, do you have any question to ask? Okay, like this we have to say. Next, third task is explain the need for the cast or supplement. Okay, so see friends, we can use signposting words like moving on. So we can say moving on, yeah, moving next. I would like to explain you the requirement for cast and split in your case. So Miss Susan, cast and split will help you in your proper healing as you are in the mobilization stage, and with the cast and splint you will able to keep your bone alignment proper, and it will also reduce further injury in your case. So are you getting my point? So friends, always check the knowledge of the patient, then move to the next point. It will also boost your marks. Okay, next is provide guidance on hygiene personal care with the cast splint. Okay, so here is also provide, that means we are giving some education to the patient. So for this we have to again say a next sentence like this. Now Miss Susan, I will also like to tell you regarding your personal and hygiene care with your cast and split. As first of all, keep it dry. Secondly, do not stick anything inside it. It will prevent further infection and also any sign of skin breakdown. You please notify us. So as like this here is mentioned sign of skin breakdown. So it is the responsibility of the patient after discharge, like if they have any sign of skin breakdown they will seek the medical help. So now I will again repeat this sentence, um, like using the signpost sentence. Well Miss Susan, I would like to tell you some guidance regarding your hygiene and personal care with cast and split. First of all, keep the skin dry. As second, do not stick anything inside the skin to prevent the further infection. And lastly, please check out sign of any skin breakdown. So are you getting my point? Like this we have to complete this sentence. Okay, next is the fourth task. Again it's a describe. So means we are giving some education or knowledge to the patient. So as a nurse we can say, well Miss Susan, I am happy to tell you regarding pain management options. Like, first of all, the prescribed medicine which you have given, please take it properly. Secondly, apply ice pack over the fracture area. Thirdly, there must be leg elevation to prevent any kind of swelling. So these are the things which help during the pain management. So friends, once again I will help you to construct the sentence like this. Well Miss Susan, now I would like to tell you regarding the pain management option. Firstly, the medicine which are prescribed to you, please take that. It will help to reduce the pain. Secondly, apply ice pack and also do leg elevation to reduce pain or to ease your pain. So like this we have to construct the sentence. Again, next sentences suggest some other strategies. Along with this, we can also say, along with this, I would also suggest you some strategies which will help to reduce pain are do gentle toe movements and also do some relaxation technique or therapies. So, are you following my point, or are you getting my point, or is that clear to you? Like this we can have to ask the question or checking the understanding of the patient. Okay, well, next is the fifth task, and this is regarding the advice. So as a nurse we can say it is also advisable for you to use crutches and walking aids, as it will help to reduce strain on the injured leg and improve bone healing for the better and balanced mobility. Okay, so we can say like this. And moving on, I would like to tell you the daily activities like gradual return and also avoid some stagnant activities initially, and with this full weight bearing after follow-up checkup extra. So see here friends, we can construct this sentence like this. Miss Susan, it is also imperative for you to use crutches and walking aids to reduce strain on your injured leg and improve your bone healing, as well as the balance. It will help you in mobility balance. With this, you can do daily activity and with gradual return and avoid some stagnant activity initially, but after your follow-up you can bear full weight on your leg. So is that clear to you? Okay, so next is the last point, that is stress. So stress need for follow-up checkup, example monitoring healing progress, cast splint adjustments, x-rays important for full recovery, etc. So friends, now I will help you in making this sentence like this. Well, Miss Susan, it is also very important and it is also required for you to do your follow-up checkup properly for monitoring your healing progress, as well as your cast and split adjustment to reduce your irritation. And also along with this, you can in your follow-up x-ray and monitoring healing during your checkups, it will help you to monitor your healing process in your fracture leg and also help in cast and split adjustment. Moreover, during your follow-up, x-ray will be done, and also it is very important for your full recovery to have a proper follow-up checkups. So are you getting my point, or are you following me, or are you able to do this? Like this we have to ask from the patient. Okay, then the patient will say yes, I will do, yeah, I will try. Okay, then as a nurse we can say thank you Miss Susan for accepting my suggestions. And see here guys, it is a orthopedic ward, so we can use the last sentence like this. Ring the buzzer. Miss Susan, if you have any query, please ring the buzzer. I will come and see you again, then thank you. So like this we have to construct a whole role play, as it is a known case and based on the ward. So it is always a known case in ward because patient is admitted in the ward. Okay, so friends, I hope uh, it will very beneficial for you in your coming exam. Thank you so much.